Hello, Miss Mellon. My name is Scarlett. I'm going to be your nurse today, okay? We're going to do a cardiac, respiratory, and an abdominal inspection, okay? An inspection on you. Okay. Are you a smoker? Okay. Do you have any issues with breathing when you're just doing activities? Okay. What about with sleeping? Fine. Do you sleep in a normal bed without any extra pillows? Okay, great. What about your health history? What kind of medications do you take? Okay. No respiratory medications, no cardiac medications. What about with your daily history?
Normal.
Normal? Okay. What about your diet?
Fruits, vegetables, and grains.
Okay, great. Were you in any pain today? No? Great. Wonderful. Well, I'm going to just go ahead and start off by inspecting you, your chest area, okay? Great. So I'm just going to kind of look if you have any, if you're breathing, normal breathing, make sure everything is symmetric. No contusions, lacerations. I don't see anything like that abnormal. With your assessment, I'm going to look at your rate, rhythm, and the depth of your breathing. Make sure everything is normal. And make sure, like I said, you're symmetric. So I'm going to palpate to see if you have any deformities. Okay? And I don't feel anything, no ribs, nothing abnormal whatsoever. Now I'm going to go ahead and percuss this area with your lungs. Okay? So I'm looking for a resonant sound, and that is what I'm hearing so far. Great. Okay. Now I'm going to go ahead and listen. You just read normally for me, Miss Mellon. Wonderful. I'm going to have you set up for me quickly. Okay, I'm just going to do the same thing on your back. It's going to be for your posterior lungs. I'm going to look, making sure everything looks symmetric. Great. Now, I'm going to go ahead and feel, see if I feel anything that's strange. No crepitus in the anterior or posterior lungs, which is great. Now, I'm going to go ahead and listen. Take some deep breaths for me, Miss Mellon. Okay. If you start to feel like you're hyperventilating, you can just calm down your breathing for me. Great. Now, I want you to go ahead and inhale several times for me. And I'm just going to go ahead and fill this area. It's called a respiratory excursion. I'm going to make for sure that everything is symmetric with your breathing. Everything feels normal to me. No difficulty breathing, Miss Mellon? Wonderful. Okay. If you'd like to, go ahead and lay back down for me. Just want you to lay down with your palm, which means right on your back for me. And we're going to have your head elevated about 30 degrees. Now, I'm going to look at your carotid arteries, okay? And I'm going to feel each carotid artery separately. Great. Now, what we're going to do here is I'm going to listen with the bell of my stethoscope for any abnormal cells, which is called ruies. We don't want to hear those. So like a swishing sound. Take a couple deep breaths for me. Okay, great. Everything sounds wonderful. Now I'm going to assess your jugular venous pressure. Okay. Look for some pulsations, and I do see those. That's great. Everything looks normal so far. Wonderful. Now, I'm going to go ahead and listen to your heart. I'm going to listen on the right side in the aortic area. I'm listening for an S1 and an S2, which are normal. You don't want to hear any adventitious breath sound. This is your pulmonic area on the left side. Then we have your tricuspid area on the left side as well. We have 3 positions we do listen for. Okay. Now I'm going to listen to the mitral area on your left side, directly under your breast. Okay? And I'm also going to feel in this area. That's the best place to feel for your heart when you feel your heart beating, which I do feel that. That's normal. So if there's any way you can turn onto your left side, I'm going to listen to the apex of your heart with the bell of my stethoscope. And this is how we assess for murmurs and mitral stenosis. Great. I don't hear any abnormal sounds. Everything sounds great with your heart, Miss Mullins. Now I'm going to check to see, I'll check on your pulses. You checked your carotid already. We're going to look at the brachial pulses. And a +1 is normal, and I do feel that. Your radial and your ulnar. I'm also on this area, look at see if you have any clubbing with your nails and any cyanosis. I haven't noted anything. Check your calf refill. It is less than 3 seconds. And I'm going to also check your renal arteries. Those are good and strong. Your popliteal pulse. That's great. I'm going to look at your dorsalis pedis and your posterior tibial on both legs. Great. Now, I don't see any edema, so none of that's noted at all, so that's wonderful. Now I'm going to do an abdominal assessment. Now, do you have any issues? You have no bowel movement issues, did you? Great. Now, let me know if any of this hurts when I'm assessing this. So I'm going to first inspect your abdomen. And I'm going to note that you do not have a distended abdomen. You do not have any abnormalities. I don't see any contusions, lacerations. No hernias noted. So that's wonderful. No masses. The contour is symmetric. That's great. So I'm just going to listen first, because if I press on your abdomen, you can kind of throw your bowel sounds off. So we want to make for sure that we don't cause any issues with that. So I'm just going to listen to all 4 quadrants. Do not notice any kind of hypo or hyper bowel sounds, which is great. Normal bowel sounds in all 4 quadrants. Okay? So now what we're going to do is we're going to do the percussion as well on this area. Now with the percussion, we're going to go to clockwise area. Okay? Great. Now, I do hear tympanic sounds. I did hear a dull sound on the right upper quadrant, which is where your liver is located. So I'm going to go ahead and percuss as well on your liver. Good. And I'm going to palpate around the liver area as well. And I should not be able to feel the liver, and I do not. Now, are you feeling any kind of abnormal pain associated in the abdominal area? Wonderful. Now, if you don't mind, just turn towards me. Your right side, I want to feel around your spleen area. Okay. Is there any pain with this? No, I don't feel anything abnormal either. Okay, great. So back onto your side, onto your back. Now, what I'm going to do is just feel where your kidneys are. Now, I should not be able to feel those. Is there any pain noted? No. Okay, great. No tenderness? Okay. Miss Mullins, I did forget to do one thing. If you don't mind, just step back up. Sure. And I'm just going to percuss the back posterior lines that you have here. Just make for sure we have no abnormal sounds. Okay, great. I don't feel anything abnormal, and Miss Mullins, your assessment looks to me like we've completed it. Everything to me looks great, and I'm glad you came in for a checkup. I appreciate your time, and we'll see you in about 3 months.
Thank you.
Thank you so much.